Hello everyone, welcome to Digital Health News. We are here today at CHiME India Masterclass 2025 and we are joined by Ms. Jane. Jane is VP International at CHiME. Thank you so much, Jane, for joining us today. First of all, how was your experience at CHiME India Masterclass today?
Well, thank you so much for talking to me. We've had a wonderful day here with the CHiME India Masterclass. It's my second visit with the group. And I have to say, in the last 2 years, the agenda's really come on in leaps and bounds and is truly addressing the issues and concerns of digital health leaders in India today.
Absolutely. Thank you so much for that. As everybody knows, digitalization is still taking shape in Indian healthcare. What do you think are key challenges that Indian healthcare CIOs are facing today?
Well, aside from the obvious things like using Gen IA and tackling the cybersecurity threat, my personal belief is that there should be a big concentration on the workforce and making sure the right people are in the right places to effectively lead digital health transformation. Because unless that happens, we're not going to be able to use all the benefits of technology and they'll all be wasted. So it's really about workforce today and workforce tomorrow.
How is the role of CIO important to a healthcare organization, given that digitalization is still taking shape in Indian healthcare and hospitals have to look beyond the head IT position? What do you think is the role and responsibility of a CIO in healthcare and how important is that role?
Their role is fundamentally a strategic role. They are in charge of the plan for digitalization and how to take that forward. So they have to be very good at strategy, very good at setting a vision, very good at leading change, building teams, building networks, ensuring that the things they buy, the technology they buy is good value for money and can actually make a change. But ultimately, the CIO's true job is to look after patients and make sure that patient care is not interrupted as they're bringing in these benefits, and also to make sure that the benefits do really work for patients and also for the nurses and doctors who serve them. So the end users, whether they be clinicians or patients, are really, really important factors in that. And I think a good CIO is somebody who will work on that principle and make sure that happens. So strategic intent is really important and thinking about the end user at the same time.
Absolutely. How is CHiME India helping CIOs come together and share knowledge and build, knowledge repository?
I think the most important thing that CHiME India is doing is having this amazing network of CIOs and other digital health leaders and really supporting them with events like today's masterclass, but other things throughout the year with its interest in accreditation and also other masterclasses so that people really feel supported. It can be a really lonely job being a CIO. You're out there on your own, you're tackling enormous problems, and they need that support from a professional organization like CHiME India. It's a big network of professional friends and colleagues who can offer you advice and support as you need it. So that's really important.
Absolutely. How do you see the symbiotic relationship going on between CHiME International and CHiME India? How can we enable more and more knowledge transfer between the two countries, between US, UK, and India?
Okay, well, that's a really good question. Thank you. So my job is to make sure that wherever I go, I enable the networks to flourish. And that's why I'm here today. Last month, I was in Dubai, United Arab Emirates, doing the same kind of thing. So my learning from all of this travel is that we have far more in common than we do apart. We're all the same at the end of the day. We're all human beings trying to improve things. And health is the thing that unites us and unifies us. And the belief in people being healthy is really important. So that's where the synergy is. We're all in this job because we fundamentally want to make people have healthful lives. And we believe that digital health, the use of technology, the cloud, data analytics, is the way in which people can have healthier lives. And that's exciting. It's really exciting. It's really encouraging. So that's where the synergy lies, in learning from each other and seeing where we can support each other as well.
Absolutely. Thank you so much. One last question before I let you go, Jane. What is your message to healthcare CIOs in India?
My message is keep up the good work. Don't forget the clinicians, I think is my other message. So in the UK, for instance, where I work and where I was in the NHS for a long time, we see far more clinicians, doctors and nurses getting involved in clinical digital leadership and working with their CIO colleagues. So I think that's a really important thing to do. So that's another thing I'd like to add to the mix. But keep going, you're doing a great job. Don't forget your clinician colleagues. Keep patients in mind. Be strategic and keep the mission, keep the faith.
Thank you. Thank you so much for your time, Jane.
Pleasure. Thank you
Have a
for
great
talking
day.
to me.